Let's talk about why brain training or neurotraining is the best training for concussion care. It's possible that if you've had head trauma, if you've had a concussion or whiplash or a major event you've gone through, you've been to the general medical facility, you've seen your doctor, and they've just told you to rest and chill, and hopefully you'll feel better at some point in time. And sometimes you do. And a lot of times you still have symptoms later on. And why is that? It's because you've bruised or damaged your brain. This is the mainframe system of your body, your entire body. This is its software program. And you didn't rehab it properly. You didn't focus on activating those brain areas that have been damaged and getting more blood flow to those brain areas that have been damaged. And we could pick on the medical people right now a little and say, I wish they would have told me differently, but it's okay. They are really busy, and honestly, they're not fully educated in brain training, and they don't have time. That's why I'm here to help, and there are other neuro professionals out here offering information and trying to help you that have gone through some head trauma. I'd like to describe a little bit about what's going on with brain training today and neurotraining. Let's first think about if we've had an injury to an arm and there's bruising there, right? There's tissue damage. It's likely we do need to rest, but then we also need to work on getting the muscle activity going again. We need to strengthen it. We need to stretch it. We need to heal that area with some good, healthy movement. You've damaged your brain, you have bruising in the brain. How do we get movement, blood flow, healing to that area? Well, we can't really stretch the brain or massage it, really. We can't really, but we can strengthen it. And we can get blood flow there with brain training exercises. There's three main categories involving the brain. First, let's talk about the eyes. Now, if you've probably seen this done before, maybe had this done to you, is you've had somebody shine light into your eye, or you've had somebody say, follow my finger, right? And so they're looking at some general visual skills to see if they're not functioning properly. Because typically speaking, when you've had head trauma, it damages the areas of the brain that control the eyes. And you can literally see it with eye function. Okay? If we know that, let's think about it in reverse. If we want to improve activation of the brain and improve cellular health and get better blood flow to the brain, doesn't it make sense that we can use eye exercises like follow my finger to improve blood flow and activation of the brain? That is one very powerful way that we can heal the brain. And there's a whole host of eye exercises. And it needs some time. You need some time to evaluate your visual skills and what's going on with your eyes. And you need some time to experiment with some vision exercises. These can be things like follow my finger, don't move your head. Watch my finger as your eyes cross and then uncross. Keep your eyes forward and notice my fingers in the peripheral. There's a whole host of eye exercises that create some incredible brain activation and is very powerful for healing the brain in the body. Did you know your brain controls everything in your body? Your brain controls all of your muscles. It's in charge of muscle contractions. It controls balance, your ability to stay upright and navigate how your body moves around the earth. It controls gut function, respiration, breathing. It controls blood flow, body temperatures, right? Blood pressure. It controls pain experiences throughout your body. It's involved in emotional regulations, in motivations, social situations, language, listening, all these different things. So vision exercise is one way to get a lot of brain activation and promote healing to the brain. Let's talk about a second category called proprioception. This is basically your body feeling things and then actively moving. With brain training or neuro training, we tend to look around the body and try different things, looking for areas that maybe don't work as well. And these are very targeted areas. So for example, we might look at, or ask the question of, can you circle a finger independently by itself without moving any other fingers? All right? This is some very detailed motor control that's happening inside your brain. And learning to move different body parts independently, it can be a very powerful way of increasing brain activation and blood flow to the brain in healing. So oftentimes you might hear that exercise is good for concussion care, concussion rehab. Yes, that's true. We typically want to promote healthy, feel-good exercise. And this could be simply as walking, right? Or light dancing. But it's really helpful to learn some specific skills in body movement to help with the brain activation and the blood flow process. It speeds up the healing process. Now, if you've gone through a concussion or you are going through one, now's not the time to tough it out and just fight through and do some sort of extreme exercise. It should be feel good, right? Typically a little bit lower in intensity, all right, if you're first starting off. But proprioception has to do with finding detailed body parts that maybe don't move as well independently, or also maybe you don't feel as well. You don't have the sensory areas, maybe some numb areas or hypersensitive areas. It's proprioception. Third category I want to talk about is the vestibular system. This is your inner ear. Imagine there's some water inside each ear, and if you've hit your head or gotten shooken up, it's going to mess up that water, it's going to shake it up, and then you're not going to be calibrated correctly. Your equilibrium will be off, right? Your GPS system is off. So your body's having a hard time navigating itself. This could be why you're feeling some type of vertigo situation, why your balance is off, you're swaying, you're listing as you walk, okay? If this is off calibration, it can lead to a whole host of other problems like gut dysfunction, all right, constipation or diarrhea, breathing problems, pain issues, instability problems, headaches, neck tension, emotional dysregulation, mood dysregulation. It can lead towards anxiety. It's kind of a big deal. When your body doesn't feel like it understands where it is in space, it's really uncomfortable. And it would much prefer to lie down, right? So knowing this, it's critical that you're working with a program or a professional that has some vestibular education, because it's important to assess how that system is working currently. Like, is it working? Are the different parts and components working? And then which parts and components need exercise? Which parts need to be strengthened to have better calibration? Okay, vestibular. Maybe you can start to see now, as we're just scratching the surface on brain training and neuro training, that you might be starting to see why doctors might not have time to learn this stuff. They have a lot of other things to work on, and the body is very complex. So as a brain professional, neurotraining professional, I'm here, there's others here that are trained in this, and that we're here to help, okay? So follow me for quick tips, subscribe, shoot me a message. I have some self-led virtual programming for concussion care specifically, as well as some other programming for body and chronic pain stuff. All right, there's a lot of information out there. Look forward to being here and sharing more information in the future. Thanks for joining me today on just this little bit of a teaser, scratching the surface on brain training, neurotraining, and what it means for you with concussion care.